Welcome to our first In Conversation for 2024. Many of you know that we have these sessions every month, and today we're starting with a really important topic, understanding and responding to disclosures of child sexual abuse from children and young people. And we are just really delighted to have a set of real experts to talk with us today, and I would absolutely looking forward to introducing them to you, but I just would like to start by introducing myself. I'm Leanne Beagley and I'm the CEO at the National Centre. And I would like to acknowledge and welcome all of you and let you know that I'm coming from the lands of the Wurundjeri people of the Kulin Nation in Naarm, Melbourne. And I would like to pay respects to their elders past and present and acknowledge the many, many hundreds of generations who have nurtured this land and this place, and also recognise that you're all coming from across Australia and across our wide land and little island of Tassie, and join with you all in acknowledging the land that you come from. We want to acknowledge the ongoing leadership of Aboriginal and Torres Strait Islander communities across Australia, and those who have and continue to work tirelessly to address inequalities and improve Aboriginal and Torres Strait Islander justice outcomes for children and young people. We also take time at the beginning of every one of these webinars, and also all of our internal meetings and meetings that we have with our colleagues, to seek to honour the lived and living expertise of all victims and survivors of child sexual abuse, harnessing all ages, cultures, abilities and backgrounds, and commit to substantially addressing the harm of child sexual abuse now and well into the future. We want to recognise that there are children and young people today who are experiencing sexual abuse, and dedicate ourselves to doing all we can to promote their effective protection and care. All right, so we are moving into a conversation that could be challenging, and we would like to remind people that we have support services in this country that people can access. We encourage you to do that if there are challenges or you hear things that you'd like to talk through with someone. Those are the lines too, and it's in the chat, and therefore you'll be able to access it in the chat. Speaking of the chat, if you have questions or you have things that you'd like to ask the panel, please use the chat function. We'll have some conversation together for around an hour or so, and then we'll move into having a Q&A type component. And of course, I'll tell you now that we won't get to all the questions and we won't be able to answer all your questions, but we'll do our very best. So feel free, with the team is keeping an eye on the chat, and we'll try to respond as much as we can. All right, well, let's get started. I am really delighted to just remind, before we get started, if you don't know who the National Centre is, you've been missing out. So the National Centre for Action on Child Sexual Abuse is a partnership between three organisations: the Australian Childhood Foundation, the Blue Knot Foundation and the Healing Foundation. It's an independent organisation established 2 years ago following a recommendation from the Royal Commission into institutional responses to child sexual abuse. We're commissioning research, building the capability of workers and organisations, and raising community awareness. And we are 2 years into our journey to establish this National Centre. So thank you for being part of our work today. All right, I'm really wanting to get to introducing you to this panel because it's the panel that I think is really going to help us do some in-depth thinking about disclosures. So what we want to do is bring together lived experience with insights from research and practice experts to explore how disclosures of child sexual abuse occur for young people and for children, and how trauma-informed responses are important so that victims and survivors are believed and supported to heal and to recover. I would like to start by introducing you to Amanda Morgan, who's a Yorta Yorta woman living on Darug country. Amanda is a child sexual abuse survivor advocate. She's an activist, speaker and a writer. She's the founder of Make a Seat Australia and a 2022 Churchill recipient. She's an advisor to the National Strategy Advisory Group at the National Office for Child Safety, the Policy and Advocacy Advisory Group at the National Women's Safety Alliance, and she's a member of the National Centre's Adult Survivor College. And she's a board director at March for Justice Australia. So, Amanda, can you give people a wave? Thank you. Secondly, I'd like to introduce Toni Cash, who's the Principal Advisor Child Sexual Abuse and Exploitation at Your Town. Toni's a social worker who's worked for over 35 years in child and family welfare, primarily in statutory child protection. She has an extensive experience working in government and non-government child protection sectors and managing therapeutic residential care services. Please welcome Toni. Hi, Toni. Thank you. Thirdly, we have Professor Patrick O'Leary, who's an internationally recognised researcher on domestic violence, gender-based violence and child protection. He's an academic member of the Griffith Criminology Institute and is co-lead of the Disrupting Violence Beacon and Director of Violence Research and Prevention Program at Griffith University. Thanks, Patrick. Might want to wave. There he is. Thank you. And finally, but importantly, Noel Macnamara. Welcome, Noel. He's the Deputy Director of the Centre for Excellence, and he's the Executive Manager for Policy Research and Advocacy at the Australian Childhood Foundation. Noel is a social worker who's worked in children, families, leadership, organisations and sexual abuse and trauma for nearly 40 years. Noel has written articles and publications, conducted seminars, workshops, spoken at conferences and guest lectured in Australia and globally. Please say hello, Noel. Thank you. And I'll get the panel to come off mute and we'll start by and get straight into this. And I'm going to start with Patrick and ask you, Patrick, to please could you tell us why you think, knowing that there is child sexual abuse is a common experience in our society, why is disclosure and reporting of harm so low?
Yeah, thanks, Leanne. It's a great honour to be here. Well, I think there's so many aspects to that question, why it's so low, but I think a fundamental reason still to this day is that it's not safe still. We haven't got the attitudes in the community amongst grassroots levels of people to make it safe and visible for young people and children to disclose. And when we think about it, if something really bad happens, you don't want to tell a social worker or a professional, you want to tell your family, your friends, who might not necessarily know how to respond. I remember some research we did a number of years ago that actually showed that people who responded, who disclosed, actually sometimes were worse off in terms of long-term effects because the response was so bad. I guess this tells us something about the decision to disclose for children is a very hard decision. And sometimes in the disclosure area, we're encouraging children to disclose, but we're not giving them the options or safety options of how do they actually make decisions who's the best person to disclose to. So reporting rates are still low. And I think there's another factor here too that I really invite the rest of my colleagues on the panel to think about and respond to is, you know, the role of grooming continues to silence children. And grooming can often seem to be normalised and even seem as helpful for a child, you know, some of the actions of grooming. And these are the very actions that silence a child from telling.
Thank you, Patrick. I'd go to Toni. What are your thoughts about you know, building on what Patrick said, what are your thoughts about this idea of silencing children?
Yeah, I mean, I think we still in our society, we don't hold children as equal to adults in our world. So there's still these views about children might lie, might not be as important, might not understand what they're talking about. So we do something that contributes to their silencing anyway, in terms of rights and the way we treat children, and not seeing them as the centre of our universe, which is what they should be. We, all adults, should see children as really the centre of the universe, whether they're your children or not. All that trite kind of cliche stuff about they're the future, but it's so true, actually. So there's something in that. And there's something in the fact that we all know sexual abuse is wrong. So, you don't sexually abuse children. We all know that. So for it to happen, someone has to be doing something very active to keep children silent and not tell, because otherwise someone, would presumably do something about it. So there are, I think, very active silencing, secrecy strategies at play. And that things like an active threat to children about what will happen if you tell. If you tell, one of the really common ones is no one will believe you. And so what happens to children then when they do dip a toe in the water to try and tell, and they don't get a really positive, strong, believing response, is that the threat that was made to them actually comes true. And that's so true of many of the threats or inducements that are offered to children. Your mum won't believe you. You'll be a troublemaker. You'll break up the family. I'll have to go to jail. A series of these sort of threats that are made. You'll be removed. And actually, in all of our states, a high proportion, between 2/3 and 3/4 of children actually are removed because you around sexual abuse, because you've got to work out what to do to make them safe. So the very threat that's been made to silence then comes true for children. So it's, it places them in this incredible sort of double bind about, well, now I'm responsible for this thing happening. And there is a lot of that isolating, silencing, guilt-provoking, blame sort of strategies that will act to keep children silent.
Thank you, Toni. And Amanda, what's your thoughts about what prevents and silences children? What prevents them disclosing?
I think that it depends on the family dynamic. As a lived experience survivor, my understanding is it depends on the family, what's going on in the family at the time. I disclosed first to a parent who did act, so I was fortunate in that sense, but I recognize that it's not the same for everybody, and that there are survivors children who want to disclose to someone, but that person may not be a parent or someone who's a blood relative. That could be someone who's in their community, who is an authority figure, or someone they trust. But there's always that reluctance around that, will they be believed? If they don't tell their parent, will their parent find out from someone else? And what impact will that have on that relationship? If you're quite close to your parent, and you don't want to hurt them, so you tell someone else, and then they find out from someone else, that can really destabilize your relationship with your parent and your siblings.
So do you think, I'm going to thank you, Amanda. Noel, I'm going to come to you. Do you think this is why disclosure can sometimes be a process rather than a single event?
Yeah, I think that's absolutely the case. When you asked this question when we were off screen, I started to write down a whole kind of list of things, and my fellow panelists have brought so many of those up. But then I started to think, well, actually, children do disclose. And the problem really centers around we don't want to hear it, we don't want to see it, and we don't want to believe it's true. So, and there's all sorts of reasons for that, both within family, as Amanda's just mentioned, but also within the professional system. I've worked within foster care, investigations within foster care agencies, where senior people in the foster care agencies were abusing children, and none of the staff could believe that. you know, so and that's that power sort of dynamic. But we shouldn't get kind of past, in some ways, shame. That the shifting of perpetrators are very, very good at shifting responsibility for their abuse onto the child. And the child believes that it's really that they've caused this, they wanted this, and all of those things. And there's lots of mechanisms that people will be familiar with, specialing and all of these things, and that separating out from other siblings in that process. And the child gets caught in a dynamic that they don't feel they can get out of in that way. And perpetrators are very good at manipulating the close people to the child and systems around the child as well, and we shouldn't lose sight of that. But I think children do very commonly, they disclose through their behaviour, either changes in their behaviour or behaviours that are inconsistent with their developmental status, and language that's inconsistent with their developmental status, but we don't want to see it, we don't want to hear it in that way, and it must be something else. When we look at the substantiation rates in child protection systems of sexual abuse, you know, they're far out of whack with what we know from survivors and when sexual abuse began. This again, it's not that children aren't doing things that let us know, but how open are we to actually hearing that and neutralising this power status between children and the adults around them?
No, thank you. I'm going to jump to Toni. What gets in the way, Toni, as an adult of not for children when they disclose?
Yeah, I think, thank you. And I come from your town, as you mentioned in the introduction. You also put up a slide that recommended people could call Kids Helpline, who are powered by your town. So shout out to the good folk at Kids Helpline just right now. I think we've been talking about this a lot. What is it that that stops people from being able to notice when children are disclosing to them? And I think there's something in the fact that disclosure is a process. So we've got an expectation, or an adult kind of concept really, that children will tell us the story of being sexually abused, and it will have a beginning and a middle and an end, and they'll do it purposefully. They meant to ring up and tell you about this, and if you sit with that idea and have this concept that when that happens, I'm going to, I believe children, I'm going to hear them, you're blocking off a lot of your listening ears and your radar around all the other ways in which children tell us that they've had an experience or more than one experience of sexual abuse. So, we really need to be thinking about this process, the way in which children disclose. So they will commonly talk to us or talk to Kids Helpline, for example, about something else. And it's that sometimes they will then give you a little bit of a dip, we call it dipping the toe in the water. So they'll start to tell a little bit of their story over time. And we have to have our antenna to be putting together the pieces of the story as children tell us the bits of the story. And there are other ways in which children disclose that aren't that I've run to tell you my beginning, middle, and end of a story. Their behaviour tells us, and that's probably a very large part of the ways in which children disclose. So their behaviour is just telling us a disclosure or about something. So small children who shouldn't know something are doing, behaving or acting with dolls or something in childcare. They shouldn't know that. So how do we then understand that that's a disclosure? And now what do I do with it? Because it wasn't what I was expecting. It wasn't the child telling me at story time or nap time or whatever. What's happened to them. And then I think the other bit that we also sometimes miss is that often for professionals, we aren't in a position where children or young people tell us. we have to form a reasonable belief about this ourselves and then create multiple opportunities for children to disclose to us what's happened over time. And we do that by being really trustworthy adults, by establishing what trustworthiness is versus, you know, the people you should be able to trust, acting in those ways so that children can rest on the fact that we are trustworthy and demonstrate that. And sometimes we have to form that belief and then create those multiple opportunities, you know, for a child to or young person to make the disclosure. And sometimes the behaviours we see are the impact of the sexual abuse. So we see it in the child or young person's, you know, behaviour at school, or their mental health challenges, or their leaning on substances, all the kinds of things that put together with a whole lot of other behaviours and things we know help us to form that reasonable belief. But I think we have to have a much broader antenna than thinking a child's going to purposefully tell me. Most children accidentally disclose, or they tell a friend, actually. They mean to, so they tell their friend, but their friend tells their mum tells the police. You know, that sort of way of, they didn't intend the police to turn up, or child safety or child protection service to turn up.
So, Toni, I think what you're saying and really getting us to think about is, how do you read the messages? And I'd just like to talk, I've got so many questions. I'd just like to get, come back to Noel around how different age groups and developmental stages, where those signals are. But I think you're also talking about leaning in and creating opportunities, building the relationship, and so that the disclosure will be safely encouraged.
Yeah, I think that's right. And having that sort of relational approach, so that children do have a person of trustworthiness, or more than one person, we hope. Let's create heaps of people who are trustworthy for children, but they've got a trustworthy place to go. And that helps with some of the stuff Amanda was raising around. There's so much to do with context and what families are like, that if we use if we engage in our practices, I'm going to be a trustworthy adult, then we can manage some of those tricky things that will arise for different children in their different contexts, because every experience of child sexual abuse is going to be different.
Absolutely. Yeah. Can I just think one thing's really important that Toni's highlighting is it really is that we often underestimate children's judgments and their wisdom. And when you're building a relationship and showing that you're up to hearing something difficult, the child's taking that in and thinks, maybe in that process I can trust this person, maybe I can tell them. And it's opening those spaces on a regular and consistent way that's reliable. And that relationship's so important.
Yeah.
Amanda, go for it.
Yeah, I'd just like to jump in here, my legal brain. One thing I've noticed is, I guess, we tend to want to get the whole story, because I think that that's how the criminal justice system frames, like, the importance of gathering that evidence, gathering all the facts and making sure there's a case to prosecute. And I think that's translated across to how we perceive disclosures, unfortunately. The other thing I wanted to sort of mention, which goes in tandem with what Toni and Patrick have shared, is that children who have ADHD and other developmental concerns, and I'm sure my colleague Noel will speak to this, so I won't take their point. But when you have different dynamics in the family where parents are trying to manage ADHD and autism and other things like that, it's quite ableist to assume that children are just going to share a story in one sitting, kind of thing. And it's also ableist to assume that they're going to speak it. It's really important that we recognize that children can be nonverbal, and that, we need to look at the other behaviors, because maybe it's not safe for them to speak it in the household. So yeah, I'll give it back to my colleague.
Thank you, Amanda. And I have to do a shameless plug for the next In Conversation, which is in March, which will be about disability. And about disclosures in that context. So really looking forward to that one as well. But Noel, tell us about the differences in the age ranges in your experience and the developmental context that disclosures happen, and what should people be thinking about to do with little children, pre-verbal and up to young people?
Well, obviously it's been mentioned there that obviously pre-verbal, we're looking at behavioural issues or concerns with that child. But even for verbal children, we have to, and we talked a lot about this in trauma, at looking at the difference between developmental age and actual age in terms of how the child is presenting. So we've got to bring our whole kind of headset around the developmental experience of these children. Lots of young children have lots of magical thinking. They have language that doesn't match a criminal and police type process, because that's one of the things. Unlike most other matters, serious physical abuse may end up in criminal matters, but most matters in the child protection space don't end up in the criminal domain. But child sexual abuse, if established, prima facie established, will always kind of go in that direction. It will be treated and wrapped around in that way. And that's why we've got this terrible thing that should be banned, in my opinion, the disclosure interview, where you bring a child in, you record and interview the child. And the ideal interview, as I remember being on a course, the ideal interview is you say to the child, tell me everything that's happened to you. And the child tells you everything that's happened to them, and you say, thank you. Now, the reason that that's the perfect interview, total fiction, but the perfect interview is because of the concept of leading questions that everybody is incredibly scared about in terms of the legal domain. Now, children actually need adults to provide leading questions and structures for them to be able to move forward with that material. They have to show and demonstrate in a developmentally appropriate way that they're listening, that they're believing, that they're accepting what the child says. Because I think Toni called it dipping your toe in the water. And we call this a kind of sliding scale of a child may say something, you know, my dad, my brother does things to me and I don't like it and I want it to stop. And that it stops there. Now, can you tell me more about what happens in that regard? Is required, but that could be deemed a leading question, you know, because, you know, in all sorts of ways. So people get very, very hung up about those issues. Our priority should be the protection of children. You know, that's our priority, I think, in this matter. We want to, where it's appropriate, prosecute those people that do these things. But first and foremost, it should be the protection of children. And the things that actually prevent us from doing that should be seriously explored and understood. You know, well, what children want overwhelmingly is for this thing to stop. They don't want it to continue. They want to be believed. They want to go on with their lives. They want to continue with their friends. They want to do all of these things. But you know, there is a duty to engage in the criminal process where you can prove those matters. But we so rarely prove them. That the overemphasis there and the underemphasis on the protection of children, because we know the removal of children isn't necessarily a protective factor for children. You know, in many cases, it can become the start of a whole set of other forms of abuse or a continuation with others of sexual abuse.
Thank you, Noel. Can I go to you, Patrick? What do we know about whether what do we know about the impact of adults' openness to believe children and how that impacts on disclosure. So the issue being, you know, this idea that children must lie, or they could lie, or what they're telling us can't possibly be right because it's, as indicated earlier, you know, hard to imagine. What do we know about that from a research point of view? Do children lie?
Well, certainly the evidence, the real evidence shows children rarely lie. It's an unlikely outcome, particularly in this domain of disclosure of sexual abuse. But what we do know is, on the other hand, where children are constructed as unreliable, not to be believed, is we have a long history, particularly in Western-based societies, of not trusting children and not treating them as credible. In fact, in law, and I'm not a lawyer, I might defer to Amanda here to comment on this, but in law, the you know, children have been in theory in law and textbooks in law constructed as unreliable witnesses, that they can make things up. Then you go into you know, the history of psychology, and you know, the Freudian work and other work of in a medical model of children being constructed as not reliable, making up things up. But we also often also construct children as not sufficiently able to articulate their needs or talk about things. So we also often diminish child's needs in the way we might respond to them. So the evidence is really clear. Children don't make this up. And children may get things confused. As we well know, a defense lawyer questioning a child and asking them about specific dates and mixing a whole range of different events together, well, most of us would get confused and wonder what was real and what's not. And this is more an artifact of the style of questioning and the sort of expectation that we place on a witness, rather than the reality. And I think it's really interesting when we think about when a child isn't believed. I think we need to really be thinking about that as an aspect of a second assault on a child, when they're actively disbelieved. And that might happen to survivors as adults throughout the whole life course, or they might be minimized in some way. And, you know, really prioritizing listen and believe as key aspects.
So that's a second betrayal, right?
Absolutely.
Now, so what I'm hearing is child protection systems and processes are not helpful in necessarily prioritising child safety at the top. Legal systems take us in a particular way. And we've also got people in the Q&A beginning to think about, well, what would I be looking for? What's the behaviours in neurodevelopmental, in neurodiverse populations? What's the behaviours in little children? What am I looking for in terms of indicators? Toni, where would you start with that?
I do a lot of training and a lot of consultation, and I talk to people about this idea of forming a constellation of risk factors to help them to reach that reasonable belief about whether a child's been sexually abused. So sort of two of those nice sort of practice concepts are this idea of forming this constellation, and we've got a few tools that we use to help people to think what would the constellation look like, and then a very common and helpful tool is this idea of consulting with others. So child sexual abuse can be really complex. So the idea of a single practitioner holding on to, you know, forming a reasonable belief and creating opportunities for disclosure, all those kind of things, it's a tricky thing to do on your own. So making sure that your line managers and, you know, supervisors and the professional support network around you is is someone you can go to get help with that idea of the constellation of risk factors. And, you know, there's lots of articles and kinds of what places you can go to get that. You know, I just use a simple, I call it buckets. I put lots of things in buckets, but a simple sort of bucket analysis tool where you're thinking about, okay, well, have I got any physical indicators here that a child might be, you know, have an experience of sexual abuse? Are there any behavioural things that are specific to sexual sort of sexual behaviours? Are there behavioural things that are not sexual? But just might be worrying me, like an internalised child or a child who zones out in class frequently. You know, so that some of those behavioural indicators. Have I got social things? Might this family be, you know, a family who are very isolated or live in very crowded situations, or a family where there's neglect? You know, so children are more accessible to people who will sexually abuse them if mum and dad, you know, live in poverty or live in, you know, caravan parks, or mum and dad maybe use drugs, and so they're not very present in the supervision and care of their children at different times of their life. So looking at that sort of constellation of risk factors, and then thinking, okay, there's a constellation here that tells me it's likely that this child has an experience of sexual abuse. And then what do I do about that? How do I create these opportunities for disclosure, and how active am I, given balancing all the other things that might be going on in a child's life? And, you know, an example might be if I've got a young person whose mental health is extremely complex right now, it might not be the time to be talking to a young person about their childhood experiences of sexual abuse when they're 16 and in and out of hospital around their mental health. But forming that hypothesis and thinking about, well, how am I going to set this up for this young person when it becomes the right time for them to disclose? How am I going to help them to understand what that will look like, and who will be the right people for them to tell? Because I think that point that we've made about it, you know, it can be devastating to tell people and they don't believe you. You know, one of the messages I've given tons of people over my life of supervising lots of people, is make sure that you're helping your young people when it does come their time. You know, they're 16 or 17, they're about to leave care, you're desperately worried that they've got an experience they should be talking to someone about, but it's probably not going to be you because they're going to exit care soon. Part of the work you could do is to be talking to them about when the time is right for you to tell that story. How do you do it, and who do you do it with, and what happens if you tell someone they don't believe you? You know, so make sure you're giving young people this message that actually that's on them. That's nothing to do with you. You've done what you should do. You know, you're doing the right thing in telling. If you tell someone who doesn't believe, well, that's a failure on the part of the adult who didn't believe you. And so it might be useful for other things, but they're not going to be useful for this bit. Let's move to the next person, you know, who should be someone who, by their position or their training or their background, should be someone who will believe you and be helpful to you with that.
Thanks, Toni. I think, Noel, you wanted to.
Yeah, just wanted to say, for those, I'm not absolutely certain of every piece of mandatory reporting law, but I know the majority of them have the part that says if a child tells you they're being abused, that is sufficient for forming a reasonable belief. Now,
absolutely, it's the most reliable one, isn't it? You don't need anything else in your constellation if you've got a child telling you
that
everything
means
else.
The individual professional, not the organisation. Because what we've seen happen is a child tells maybe a teacher, maybe somebody else in another setting. That person then takes it to their boss, who takes it to their boss, who takes it to their boss, and suddenly it becomes unreliable. and maybe we shouldn't be doing this in all sorts of ways. We had a very famous case in Melbourne where the principal said they wouldn't report the matter because they didn't believe it, even though it wasn't disclosed to them, it was disclosed to the teacher. And then the magistrate in the court supported that, even though it was subsequently proven that this child was sexually abused by the person that they said they were being sexually abused for, and she went for another 2 years under that circumstances. So we need to look carefully, all of the organisations need to look carefully at mandatory reporting, those that are subject to it. If the child tells you they're being abused, that's the grounds on which you move forward, and it's the individual who makes that report. And it's really important that, you know, disclosures come in so many kind of packages, you know, the spontaneous disclosure. Something is being talked about, something is being shown in the classroom, a spontaneous response from the child, the unintended disclosure. But doesn't your dad do that? Doesn't your brother put his hand in your underwear? The pressure relief disclosure. I need to tell someone, and Toni mentioned it's a friend maybe, I need to tell someone, and then it tumbles from there. The angry disclosure. And all of those can be accompanied by retraction because of the weight and the pressure that's on a child now once that's out in the world. But that retraction is a part of this process we're talking about for many children. It does not mean it did not happen, you know, or it's not happening, you know. So there are all those things happening, I think, for so many children.
What are you reflecting on, Amanda, as you're listening to these wise practitioners around, from your point of view, around the kind of the layers of barriers? There's layers of barriers. So we're talking about verbal children here, you know, and even then there's barriers to being believed. Even then there's, you know, being able to tell, to disclose in an individual situation and is already tricky and may not be believed. So what about all of those instances where there's additional barriers, additional layers, and additional context? That means that a child is just not going to be heard.
Thanks, Leanne. Where should I start? How much time do we have? I agree with my colleagues. I think that children who are culturally and linguistically diverse, like myself, I'm First Nations, proud Yorta Yorta mob, we face different kinds of barriers in terms of cultural responsibility, cultural expectation, the way that we yarn together or don't yarn together, and different, I guess, levels of hierarchy and how that shows up. I think that talking to the point that was made earlier about a story being kept with one professional, that's not safe. And I think it's really important that if you're given a disclosure that you're in a position where you can be a courageous person. I don't think we talk enough about courage, and I don't think we talk about the fact that it doesn't matter what profession you belong to or what the law says or what community you come from. Child sexual abuse can happen to any child, and anyone can receive a disclosure. And I think it sends a dangerous message to focus on a reasonable belief, even though there's, you know, history behind that concept. I think it sends a dangerous message. I think it's each and every single person's responsibility to be a safe person in the way that is you know, comfortable for them. And whether that means that you inquire about personal training or you know, do some research outside of your work situation, whatever that looks like. But it's really important that we take individual responsibility.
Thanks, Amanda. I'm going to come over to you, Patrick. What are your reflections on what you're hearing in terms of where are the gaps as for practitioners and governments?
Well, that's such a topical thing at the moment in terms of how we invest, you know, years after the Royal Commission into continuing to raise awareness. Now, I'm conscious that we've had a recent campaign of the National Office of child safety, one talk at a time. And that, you know, prompts questions about, well, what does that mean for service delivery? Do we have enough services? Do we have enough trained professionals to really respond to this raised awareness? But moreover, it speaks to Amanda's point that we all, regardless of our position, have a responsibility to be informed and be okay and be a safe person for children to disclose. And it highlights something that, you know, has been implicit in a lot of people talking about children when they make a decision, or that it inadvertently comes out, or they begin a process of disclosure, is the courage it takes from them. And they're inviting us to be brave as well. And, you know, working with children who have made a disclosure, I often ask them, how scared are they? And, you know, they can be 9 worth of scared out of 10. Well, it takes at least that much courage, or if not more, to actually be in that space. So that really invites and gives us a responsibility, and governments a responsibility, to be brave in what we do, in both policy, in legal things. We've highlighted some things about the complete injustice in criminal courts in regard to often survivors being put on trial, not the perpetrator. And this requires major reform, because those things play on people's minds as they move through the life course, thinking about disclosure, is, you know, who's going to be put in judgment? And I think this requires some more, you know, radical pushing in terms of how we actually start to prioritise the needs of victim survivors within our systems, within the service system, within the legal system, and the criminal justice system.
Can I go to you, Noel? What do you think are the things that need to happen from your point of view, in the child protection system around this?
Well, I think, you know, in a way, the family and domestic violence movement has a lot to help us with here, in the sense of the system. I'm around long enough that nobody wanted to know about family violence. Child protection said it was a relationship problem. The police said it was something else. And everybody, you know, and we've seen, it's by no means in any way perfect, but we've seen this kind of shift that accepts these basic premise, you know, that children rarely, if ever, make up these as a story. I was giving evidence in court where the magistrate actually said from the bench, memory. Well, I'm not sure if things are a memory or a daydream or a nightmare. How do you sort them out? Just because the child says they remember this. Now, you know, in 2022, or it was 2020, I mean, we're still in that kind of place. So we need the education for those within the legal profession. We need this shift, you know, as we've seen in the adult space, for victims, in terms of evidence giving and how it's accepted, and an understanding of the traumatic impact of these things on memory. Even if a child had you know, was able, you know, this idea of day, date, time, place, color of the walls, you know, what jumper were they wearing, you know, did they have their pants off, did they have them on, all of these things that become part and parcel of the police inquiry, and that those people need to be much more aware of child development. The child protection system itself must not be afraid of this issue. It should be championing this issue. It should be creating systems and processes that allow it to have what we're talking about here, is a process of interviews with a child, establishing trust and safety with the child over a period of time, utilising those that already are close to the child in terms of other professionals, and being able to make use of that, or a whole range of things that are done elsewhere in lots of different ways. But we really need to start thinking, we haven't got this right. The stats tell us that. The children tell us that. The adults who were abused as children tell us that. And yet we don't seem to be making any real movement in terms of how we go about what we're doing. And so there's an awful lot to be done. That point, you know, I just looked at some of the questions there, and somebody's talking about the kind of hot potato effect. As soon as the kind of child protection, child sexual abuse comes up, everybody wants to pass it to everybody else. Well, we should be holding it in the way that Patrick and Toni and Amanda said, that every adult should be responsible for their own practice and how they view this, but also for the safety of that child, safety and much broader well-being of that child as well.
Toni, can I go to you? What do you think? So we know that these webinars are really popular with practitioners, but also with the broader community, with people who live with their own story of child sexual abuse, and with policy people. So we've got and with the researchers. So we're delighted that we do have such a broad. What would you be saying to specifically to practitioners? We've heard a bit about the legal system and a bit about the broader child protection system. What would you be saying to practitioners today about what they need to be doing?
I often talk to people about, you know, go from this conversation with your invisible badge or T-shirt that says, I'm a believing adult. So that, you know, I think it's, in some ways, it's as simple as that. Just believe children when they tell you stuff. If as there is almost always going to be a range of complexity in, you know, what we do and how we do that, and the involvement of different parts of the system and, you know, all those kinds of things, well, just hold all of that worry and doubt behind your eyes, and, you know, keep it in the back of your head. The eyes and the face that you turn to children need to be, I completely believe you. I'm going to be here. Let's slowly, patiently, carefully continue to talk about this and work it through, and next step, next step, next step. So I think there's that, you know, do that simple but complex thing of being a believing adult. I think this idea that what we would really like in disclosure is for children to tell us as soon as they possibly can. You know, the earlier that the disclosure occurs, the better our chances are of creating, you know, healing and, you know, mitigating sort of opportunities for children. So it's best if they tell us while it's happening. And we know actually from the research that there's significant delay in children telling us. So they generally won't tell us until after it's stopped and some period of time has passed. And we think that's probably to do with, you know, the threat or whatever's silenced them becomes less intense or has less power over them. And when that happens, then they can tell. So there's, you know, what we want actually is for our practitioners to be thinking, how can I reduce that time delay, and how can I create this opportunity for children to tell as close as possible, or even while it's happening, you know, so that we can intervene, not just for safety, but as Noel was saying, safety is very important. I don't want to minimize that, but actually this is a life course event. The impact of sexual abuse on people continues all through their life journey. And we saw people, you know, coming to the Royal Commission and telling their story decades and decades later. And we're seeing the apologies being made now, you know, to people who are elderly. You know, we know this has the impact, you know, all through people's life. So we're really, yes, of course, safety and well-being. And how do we, how are we positioning for people so that they, you know, the known impacts of sexual abuse on them are going to be lessened.
Yeah.
And
Or can I just tell you that Noel's internet went down, but he will be back. So just to let people know. Sorry, Patrick.
no, I was wondering where Noel went. Yeah, I think this point that Toni's raising is really important, and it goes back to an earlier question about disclosure being a process, and that's a process out throughout the life course. And what I hear sometimes from survivors, you know, young people, young adults through to older adults, is sometimes when they retell their story, people's reaction is, "Oh, you've already told us that," or, you know, "That was a long time ago," or a dismissal.
Aren't you over this yet?
Yeah. And what we really have come to understand in the whole, you know, process of understanding the effects of complex trauma is that, you know, people might go through years where, you know, it hasn't, the effects of trauma are less to the surface, but something might happen that brings them out, and it's important for them to tell their story, to let someone know they're not feeling safe in a particular situation, and this is why. And so we can't think about disclosure being a one event and that it's all done and dusted in one event. It's a process throughout life. And you know, that means that we have to be believing adults, believing friends, family, professionals, no matter what the age of the person telling their story is.
Thanks, Patrick. So, a really important reminder. Amanda, what's your reflections on you know, where the gaps are that we could address, and potentially what you think the strength of people who tell their own stories have as lived experience advocates like you are to kind of create some change in where there's gaps?
Thanks, Leanne. I have a couple of points I'd like to share. I think that it's really important that we don't view disclosure through the lens of the child purely, because I think that puts a lot of responsibility on children. I think that the important question we should really be asking ourselves is, in terms of what Patrick just shared about the whole process, are we willing to meet children where they're at whenever they're willing to share? Are we expecting children to share in one sitting? And I mean, if they do share, what if that sharing is not completely accurate, or it's a part of a different story, or part of a greater story? I really want to emphasize that I think that there is a lot of, and I know we've sort of talked about this previously, but there's a bit of an emphasis on the kind of right way to tell a story, and there is no right way. So I want to address that. The second thing I wanted to share is that survivors, our healing journey isn't linear. It's not a straight line. And for some folks, I think that there is a benefit in sharing their story amongst peers, amongst other survivors, because they feel heard and they feel like they're in a community, in a supportive environment. But I also think that it's about being a safe person in a collective. I think that there's a lot of a need at the moment to remember that you're not alone, but that also there are a lot of survivors with a lot of different circumstances. And it's really important that when we talk about storytelling, that we're amplifying the voices of folks who are not in the same space as we are. So it might seem like a cliche point to talk about intersectionality, but I think it's really important that we remember that there are communities where it's not okay to talk about child sexual abuse, because they might be patriarchal communities where it's like the perpetrator lives very much in the community and has a place of authority. Like there are a lot of different layers, and culturally, religiously, like all of these different nuances that are not necessarily conventional or traditional. And I think it's really important for us to give consideration to that. It's not just about being trauma informed, it's about being culturally safe. And listening to those stories, because the solutions, we talked about justice, but the solutions for culturally and linguistically diverse communities don't necessarily look the same as what we expect, what we're used to. And so I think that, you know, we need to consider that, not just in this how we tell the story, but in the setting. You know, I'm grateful to be on this panel today as a First Nations person, but I'm conscious that there should be a First Nations person, a person with disabilities, a person from the queer community at every opportunity, not just around IWD. And I say that because it's next week. We're not, you know, rolling out the survivors to tick the lived experience box. We
So
exist here. And
can I jump in there, Amanda? Because, you know, we're getting some questions now around, you know, how do I give a child time to disclose when I've got to act quickly on a mandatory report, or how do we deal with a parent who, you know, has a disability, or a child who is nonverbal, or, you know, so there's a range of contexts, right, in which, because every child is different. And every context and family is different. And I guess the challenge is, you know, how to get, you know, a handout with 10 dot points about what to do, when in fact every single situation requires time and engagement and relationship. And, you know, I guess, oh, here's Noel back. Excellent. Welcome back, Noel. Toni, what's your take on that piece of kind of wisdom from Amanda around, you know, the intersectionality, which is about how disclosures might be made, but also how we respond, how communities understand them, and what the taboos are, and then and how to work with that.
I think we've had some really good concepts and ideas that help with this. So, you know, the idea of courage, the idea of advocacy, the idea of, you know, I love the idea of understanding the intersectionality. You know, what can I do in my space? So, you know, that sort of sense of you know, I've come from a long history in the child protection system as well. So that sort of idea that actually I've got something, I've got timeframes, I've got a, you know, a structure I have to respond to, I've got policy and procedure that guide me. I don't necessarily have a relationship with the child I've just turned up at the school to interview, you know, all of those kinds of things. But I think one of the skills that we need to have is this thinking about, well, systems thinking, really, isn't it? There are other places and people in the system, and I wouldn't necessarily, well, I wouldn't interview a child using an Evidence Act interview in a lot of circumstances. Or if we do, because we've made our best judgment and that was the way we went, and we then don't get a disclosure, but we think there's a story to be told, where are the other parts of the system that we, you know, that we can, where we know children might go to in the future? So it's, you know, how it might not be me that has that relationship. And Noel was talking about this earlier, about the people who have knowledge and a relationship already with the child. How is that going to help me with, you know, with the opportunity for this child? How do we listen to our First Nations elders and community people and people who know how to balance the nuances and trickiness in their community that will be different in this one from this one from this one? They're never, you know, they're not the same. You can't think just because I've worked in that community and I know that community well, that the same thing will unfold in another community. So what I do know, though, is that there are people in that community who do know. So, you know, wrong to use the terminology, not quite right, but as a shortcut sort of terminology, who are the consultants? Who are the people with knowledge? Who are the people with influence who can help us to work out how we think about the rub between, because there's often a rub actually between what we know about processes of disclosure, and we've talked a lot about it in the justice system, but it exists in the child protection system too, how the child protection system would really like when they talk to a family about child abuse, they'd really like child sexual abuse, they'd really like it if mum believes that the child, because that then there's a safe and believing adult who will take action to protect the child. But actually mum might have a whole lot of stuff of her own that she needs to go through that she doesn't go through in the 28 days that it takes to get from the, you know, the point where you got the notification to the point where you're supposed to form a view about what happened and write that down. So, you know, I think it is about holding this idea that it's a whole community of people, all of us in different roles, in different professions, in the formal and the informal, the paid and the unpaid, you know, how do we all together, you know, and that helps with Amanda's sort of comment about actually we have to pace against the needs of the child, you know, and not necessarily, sometimes that means we're sitting with an incredible level of risk and discomfort around how we look for safety when we don't even know that we're making a child safe from something we're sure has happened to them.
What, thank you, Toni. It's just, I could listen all day. Noel, now that you're back, it won't matter that you missed a little bit. I want to ask you, what about the challenges and complexities when a child is disclosing that they've been harmed by another child or by another young person?
Well, there's a substantial research now saying that this might well be the highest form of child sexual abuse occurring. So there's a number of those studies which are looking at that. So it's very important that the adults that are involved with this keep an open mind about what's being said about who. When a child says something's happening, but they're not identifying the who, that there's not just a kind of tunnel vision, but this is spread across both internal to the family, but external to the family, or wider in the family group, or external to the family. It's very important that we understand that. It raises a great deal of complications for families, particularly when it's internal to the family, brothers and sisters, and how do you keep safe within the context. Child protection may have one view about that. Families may have another view about being able to keep their children safe. It should never be underestimated, I think, for all of the players, that the great influence of shame for the child themselves in these matters, but also for the parents. I think I couldn't possibly count how many times it's been said to me, I would have known if this was happening. Then that may morph into, I should have known this was happening. But in some cases, it never gets past, I would have known. And in a lot of the families, certainly I've worked with, there is an intergenerational sexual abuse. When you talk to mum says, yes, I was sexually abused. When you talk to grandma, she says, yes, I was sexually abused. This is across the community. This is not one particular part of the Australian community, but right the way across. And so the mind maps that people have about what's safe and what's okay are really, really challenging, but between children. You know, I've had people say to me, I'll sleep on in the hallway between the two bedrooms in terms of siblings, and that will keep them safe, as if this could only possibly happen in the bedroom. You know, so the educating of people about what this is, how it can happen, you know, an act of sexual abuse can happen within moments. We saw that in particular when we had a police surgeon in Victoria who was sexually abusing children while examining them for child abuse crimes committed against them. You know, these things can happen in a moment, but people are not aware that that's possible. They think of something like a relationship, but sexual abuse can happen in all sorts of ways, both between young people. We know that, you know, the work done with the Royal Commission and Moore's work around safety in residential care, the amount of sexual abuse is perpetrated from one young person to another. Our focus had been, and rightly to some extent, on the adults in that system who may present a danger. And we had really not plotted the amount of harm perpetrated across the peer group in that space. And we must, you know, that these are all things that we must be fully open to in that regard. You know, I was just kind of thinking when I was trying to bring my system back to life that you know, we've got a moment, we've got a kind of image that that it's teachers and priests who sexually abuse children outside of the home. That maybe we need a campaign that actually shows the very broad range of people that have been convicted of, and convicted, you could go just with that end of it, who've been convicted of sexually abusing children, you know, and it involves every layer, every social group, every professional group across our community. You know, and some of the research that came out sort of fairly recently, but also is replicated for research about 25 years ago, asking young men in university, would they sexually abuse a child if they could, if they thought they could get absolutely away with it? When 30% of those responded yes. I mean, this is, I think we have to look at our society as well, much more broadly. It's not the nature of this particular session, but I think we have to understand, what is this about? I know I've strayed there, sorry.
No, and great that you could come back and join us. I noticed that we only have a few minutes left, and I would really like each of the panel members to be able to kind of sum up from their point of view what they'd like you to take away from today. And because I think, you know, we've had a really in-depth conversation around disclosure, and just really very grateful to the panel for their input. I guess that we wouldn't have been able to answer all of the questions and the comments that are made, but it would just be terrific if each of you were able to just summarise what you'd most want people to hear from today about disclosure, and do when they get up from their chair and walk away. Like, what is it that you would like people to hear? Amanda, I might start with you if that's okay. Is that all right?
Yeah, of course. The thing that I want people to think about is, what does grooming look like to you? What does that behavior look like? And if your gut is telling you that something might be off with a child, or even with an adolescent or an adult, follow that intuition, follow your gut, and have some courage, because it's better to be wrong than to not have investigated it, to not be that safe person. You might be the difference in a survivor's life. You might be that difference. So be courageous. Don't be afraid to be wrong. It's okay to be wrong. There are worse things in life. Yeah.
Thank you, Amanda. Toni.
Oh, I've probably already said mine, which is be trustworthy, and it aligns well. I mean, Amanda uses different words, but courage or being brave. You know, we've all talked about this. Have the, you know, trustworthy people lean in. They're courageous. They look for things. They do things in the face of messages that they shouldn't be doing things. They think in different ways. They encourage disruption, those kinds of things. So I think it is that be a trustworthy adult, and the T-shirt, the invisible T-shirt or invisible badge, or why not? Let's just all wear them. I'm a believing adult. You can tell me, and whatever you tell me, we're going to be able to work with that. You know, for your children, who are related to you, for the children you work with, for the children that you see passing in the park. You can tell me anything, actually, and it'll be okay. We're going to be able to do something with it. Is my sort of messages.
Because you know, I was just checking in the Q&A, and there is a sense of like, what happens if children retract? What happens if, you know, children not believed? Would it be right, Toni, that you would be encouraging people to just keep trying different avenues, different doors, different opportunities? Yeah.
And I often, you know, when I train, the session on disclosure is titled Disclosure and Recantation, because there's sort of two sides of the same coin in one way. And, you know, I talk to people about, if you've got two pieces of information here, one is that the child's, you know, telling you or indicating this part of the story, but then they tell and they take it back in some form or another. We really understand why they do that. We understand about secrecy and silencing, so it makes logical sense that they would do that. So of the two pieces, which one do you lean on and weigh and have, you know, greater belief of? Well, it's the piece of the story that tells about the disclosure. And so, yes, hey, you then, yes, it's an additional complexity, but now how do we work with that additional complexity? And the message would still be, I get that there are reasons why you might want to get back under the cover of secrecy, really. But I want you to know that I still believe the story. And I believe you've probably got more story to tell. And I would believe you, and we'll be able to find some way to deal with this, to do something with this.
Thanks, Toni. I'm going to jump to Patrick and hope that you're going to speak about the influence of shame.
Sure. The influence of shame. Yeah.
Yeah.
Yeah, I think, you know, in wrapping up too, you know, shame is something we've got a real responsibility in changing attitudes, but challenging stereotypes. You know, we think about, for example, you know, often in the case for boys, their fear about how they'll be perceived as a survivor if they disclose, that their identity as a boy will, as a male, will be put in question, that they'll be seen less than. And similar stereotypes apply for girls and how they'll be constructed. So shame not only comes from the abuse itself, but it's also the structures and the stereotypes and the way we model dominant ideas of identity. And I notice in the questions here, there's you know, the issue of, you know, the extra challenges for LGBTQI children to disclose and how they might be perceived, and how that takes an extra bit of complexity. It speaks to the issue that Amanda was raising about intersectionality. And I also see in the chat or the questions about the real problems we've got, you know, in terms of the system. People have mentioned the family court and you know, where that's a whole minefield. And unfortunately, we don't have the time or space today. But it is something about how we reform systems. The other theme I think people have raised in the question that does speak to shame is that people get referred around. And so a disclosure is made and quickly the hot potatoes pass, I think Noel said. And that adds to shame, because I've had feedback from survivors who have said, I'd really trusted that worker. And when I told them, it felt like it was just too shameful for them. So they quickly referred me.
Mm.
So it's how we stay with people when they make a disclosure, children, and actually see it through. As that not only as the system responsibility, but our own responsibility as a professional or individual. And that requires us to really challenge the system, be brave in challenging how we're actually changing the system. We often can blame the system, but we often can be complicit with the system by not continuing to challenge it. And child protection systems have come a long way, but they still have a long way to go, as do our judicial systems. And they add to the shame of the situation.
Yeah. Thanks. Thank you so much. And Noel, what's your sort of summing up sort of advice to people today?
I think it'd be good for people to challenge themselves and to challenge those around them. But if things come up like, this child's too young to let us know that they've been sexually abused, there's nothing we can do about it. Adolescents, teenagers always lie. They're always making up stories. They're always angry. So we can't really trust what's being said here. It doesn't happen to boys. This is not sexual abuse. He, she took gifts, money, booze, etc. All of these things we must outwardly challenge, and both inwardly and outwardly challenge ourselves. Why did, in this real reflective process, why did I think that? And then challenge others around us. Why are we talking like this? And to really engage in that process in every matter. That these things come up, and for those groups to challenge other groups, to challenge the police, to challenge the judicial system, to challenge in all of those ways that these falsehoods that this whole system is kind of built on in so many ways, children that are being sexually exploited are not being sexually abused. That's not rape. That's this other thing, exploitation. It's rape. And somehow we with all of this, we soften out this language. Even sexual abuse is this softening out of this language. We're talking about children being raped and sexually assaulted. And those things. I'm not sure why we don't change all of that to really reflect what's happening to so many of the children. So I know not everybody's keen on that, but I just don't understand why we soften it up to make it appear like something else that's not quite as bad.
It is. Look, I really hit you. Challenge accepted.
Okay.
Because I think the National Centre is here to do that, and we do have a piece of work we're doing right now in examining, getting a shared language that's meaningful, that makes sense for those both who live with the experience of child sexual abuse, but the community, so that we can start to really push, because we do soften it, don't we? And we use it to turn away or to minimise or whatever it is. And these are children being hurt and harmed. Thank you, each of you, for your amazing wisdom. When I read all the 30 years and 40 years of experience, I thought, wow, these are elders, and we're very grateful to have had you today and your input. We will, there's a recording of this that will go onto our website, and you'll be able to find it or share it with friends or colleagues. And also that we will send out we'll pop it up on the screen too, but we'll send out a survey for people to give us some feedback. We do want to keep improving these sessions and make sure that we do respond to your feedback about how we can, who we draw together and how we manage. So we do have our next in conversation is about experiences for and with people with a disability. We will have a panel that includes people with lived experience and practitioners and researchers in this space. So we're really looking forward to sharing that with you. And I think there will also be a little QR code coming up on the screen for you to do the survey. Can I just thank, on all of your behalf, folks, thank this amazing panel for their time and their contribution today. It's been wonderful. Thank you, and have a great afternoon, everybody.